Hello and welcome. Effective June 30th, 2021, Green Shield Canada will be including a gender affirmation offering as a standard benefit in all group plans that provide extended health services coverage. This offering is an important step in delivering inclusive benefits coverage that enables employers to support plan members throughout their gender transition journey. My name is Jeanette Novak. I'm a Right Path advisor at Select Path Benefits, and I'm a mother of a transgender teen. I'm joined by Melissa Blanchette, supervisor in claims pricing optimization at Green Shield Canada, and a key player in the creation and approval of this new benefit. I'm also joined by Jennifer Gratt, who is a certified human resources professional at Select Path Benefits. So ladies, thank you so much for joining me today. The topic for this discussion it's big, and there is a lot to cover and so much to understand. And I think it's incredibly important to get this kind of information out to both employers and employees to reduce the stigma and break down barriers and help businesses and organizations strengthen their culture of diversity and inclusion. So let's get to it. Melissa, can you tell me how the discussion around adding a benefit of this nature started?
Perfect. Yes. And just to thank you for having me today. This was a great opportunity just to talk about this piece of conversation, and I think one that really needs to be talked about a little bit more so that people can start feeling comfortable with being uncomfortable. So this started with one very progressive employer asking some very pointed questions a few years ago. And in order to answer those questions, we needed to understand what happened at the provincial level and what the patient had access to. This was the beginning of our education in a space we had no experience. We realized we had no experience. But at the time, there was only one solution available that we could implement quickly, that they needed immediately. But more importantly, we started a larger conversation around who was affected, what kind of access to care that they had, didn't have, where could we find the expertise to inform decision-making on a go forward for us to be able to close those gaps. So this is always something that's important to Green Shield, allowing all Canadians access to healthcare and allowing them to live their best lives. So we recognized a gap, and although we could solve the plan member or the plan sponsors questions with a solution at that time, we realized that this was a much bigger story that we needed to tell and finish up.
So you had mentioned that at that time there was just one solution for that employer. What was that solution?
Right. So that solution was a healthcare spending account. So we built them a gender transition healthcare spending account with process built in where the employer had to be involved at the very beginning of a person's transgender journey. The person had to basically out themselves to their HR representative. They had a list of things that they were allowed to claim. There's a process by which they had to claim those things. We allowed that to go to fruition as per the plan sponsor's wishes. So it was a double-edged sword. It was a really great way to allow a person to have this extra benefit because there was a really progressive plan sponsor out there, which we recognized that at the time was amazing. But on the back end, we also realized we could do a much better job in being able to handle this. So it was really an eye-opener and an education.
So essentially, any plans that do not have this benefit, so with a different carrier, say, would have to resort to the healthcare spending account, just as you did back 2 years ago. And are we saying then that in order to have that type of health spending account, it would be necessary for the person transitioning to disclose that kind of private information?
In that particular circumstance, yes, because there was a process by which they needed it to follow. And yes, it's, on that side of it, they were able to access this benefit. But in the meantime, they did have to disclose very personal, very private information.
Yeah. So essentially, we've broken down that barrier by adding this benefit, because if somebody does not want to disclose, the privacy that does surround the group benefit plans would be intact, right?
That's exactly right.
Amazing. Jen, from an HR perspective, are you finding, on the topic of transgender rights and accommodations in the workplace, that employers are currently and now being proactive or still reactive?
It's always going to be a mixed bag. I don't like to kind of overgeneralize with organizations, but with any sort of social change, there are going to be some that kind of lag behind a little bit and are certainly reactive. And I think what's happening there is the employer thinks that they don't need to be proactive per se. They'll just worry about it when someone who decides that they're going to start their transition journey, or they hire someone who's transgendered. But you don't always know who may start that journey or who is transgender when you hire them on. So there's a lot of things to do kind of beforehand. And I don't think that many employers realize the things that they can do to make themselves a more inclusive employer. I think we're getting there, and a lot of places are being proactive. There's still a lot that are not.
Awesome. So Melissa, can you tell us how you presented your thoughts and your ideas around this benefit to Green Shield, and what the initial reaction was?
Absolutely. So I work for a company that is very progressively minded, always open to new ideas, conversations. We tend to not shy away from anything. So as these conversations were happening and they were getting bigger, and they were mostly surrounding the HCSA side of things, I decided to put a research paper together. This is part of my role. It's what I do for Green Shield. So I was able to put this research paper together and present it to our Health and Dental Evaluation Committee, of which I'm a member. And it sparked amazing conversation, really good questions. And I ended up with full support to move forward with a large scale project, having almost every aspect of Green Shield's inner workings and operations involved. So it was a really good start. We knew it was going to take quite a long time, but it was a really good kickoff.
Awesome. Jen, can you give us some examples of the types of accommodations, standards, and education that would be necessary in the workplace to ensure that a transgender employee is fully supported?
Yeah, for sure. There's a lot of little things that employers can do to help make someone feel included and supported and safe in their work environment. So some of the big ones would be dressing rooms or bathrooms. And ideally, it's nice for employers to have a gender neutral space for someone to use that washroom. in change rooms, having a private area if they want it, and just making sure that the washrooms are available to them of, where they feel most safe and secure, and just having that option available to them. We have dress code, making sure that there's inclusive language there, in regards to being able to dress as your gender identity, within the dress code guidelines, having more gender neutral uniforms, or again, leaving that option open to employees so they can choose which one fits them and makes them feel safe and comfortable, all while following the employer's guidelines on that and the policies. There is also a need to do lots of discussions with that person and the leadership team or HR, and make sure really that any accommodations or training or anything that's taken place there is truly helping that individual, and what they need, what their timelines are. When do we want to start calling you by this new name if they have a different name that they're going to start using? What about pronouns? How are we going to address that? Do you want to reintroduce yourself, or talk about your journey with your colleagues? Do you want the employer to take that on, and make it generalized? How does that person want that to really come out? It's not about necessarily the employer, taking the driving wheel of that. It's about kind of having that open communication and doing things on that person's timelines. And again, the ultimate goal of them being included and safe and supported. Some things can be, you might want to take a look at your employee information forms. If there's a gender box on that, is it male or female? Is there another option to that? Is there a blank box? Do you not even have the male or female check boxes? Is it just one blank box? Those are things that you may want to take a double look at, and make sure that there's inclusive space there, so no one is feeling contradicted there. It's good to take a look at your benefits, is a huge one. So does your benefit plan have fertility coverage? So most couples in the LGBTQ community are not conceiving naturally to have children. So what kind of benefits are there for them to start a family? And that goes for retaining top talent, recruiting top talent. A lot of people have their options for employers. And if you want, a specific person, it could come down to benefit coverage and how that coverage makes them feel secure and supported. And that kind of goes along with the culture a little bit as well. There is, of course, making sure everything is confidential, keeping that information close, not sharing it with anyone where they don't need to know, as need basis, and having inclusive language. Just how you address people, how you talk to them, how you talk about people to colleagues or management or whomever, making sure you're using the pronouns that you've asked for in your discussions with them, and making sure you have that kind of clarified.
And Melissa, in the work and the research that you did, I know as a mother myself, obviously, when my daughter told us that she was transgender, there was an awful lot of research that I needed to do to make sure that we were fully supporting her in the way that she needed. What do you think was the most groundbreaking piece of information or something that you learned through this process of research?
I think if there's anything that really informed the structure of this benefit is that every journey is unique. You cannot paint this process with one brush. A transgender person needs to follow their own path at their own pace, and they need to be able to make the choices that are best for them. It may be an employer's best intention, or even society's best intention to put them in boxes or bucket them into, well, you should be this and you should look like this, and when are you going to do this? But we've learned that is not the case. They need to be able to make those very important decisions on how much to do, if anything, and when to do it and when it's comfortable for them. Mm-hmm. What we need to remember, I think, in all of this is there's also a family usually attached. There are support folks, there are caregivers. So we need to remember that this isn't just the person's transition. And Jeanette, you're the perfect example of this. There is, other people, affected, and they want to be able to support their loved ones, but they might also need some support, right? Yeah. So even though the transgender journey is unique to everybody, it's also being followed by usually one or two other people, if not a whole family. So, that's it. Everything is affected by that journey.
Yeah, absolutely. And you're right. It's my whole family's journey, and my daughter fully understands that. But that's the part that makes her feel most secure, knowing that she has her whole family going through this journey with her. And I do absolutely agree. It's so individual, and I think the work that you have done and the understanding that you have on simply that it's individual is so important. My story about this is that my daughter was working with a psychologist that gave her timelines for going to a mall and finding female clothing between this session and next session, so that you can get used to dressing as a female, which for us we actually had to stop visiting the psychologist for a little bit, and just pause and take. My daughter literally needed to take her own time, because for her, she didn't actually understand why it was necessary, even though she is a female. In her mind, in her body, she is a female. But she didn't understand why identifying as a female meant that she had to wear female clothing. So I found that really fascinating, because that advice came from a psychologist. And so, whilst you're doing this important research, I think that it's ongoing. And I do also think we have some archaic information that is very much outdated, that needs to be updated, and we need to be constantly listening to the people that are going through these journeys, and really reevaluating our thoughts and the way we're discussing and the way we're providing advice. So individual. So Melissa, I know it's a huge topic, but can you walk us through how getting a benefit of this nature happens at Green Shield?
For sure. So you're right. It is a huge topic.
Yes.
For this particular project, we realized it was going to need 3 phases. We were going to need to separate the research and benefit structure creation from what needed to support it with the system enhancements, but even as importantly is the training on the gender diversity side with our staff. So we also needed to look internally, what we were doing at Green Shield was just as important with our own employees as what we were doing with this benefit externally. So things like Jennifer was saying before, we're going to need to look at our washroom structure. Is it appropriate? How do we need to, structure the building differently to accommodate? What about the forms? How are we referring to gender? Is it appropriate? So it was just as much a conversation internally as I was saying as externally. So breaking it down, the first phase, which was the biggest phase, which took the longest, was the research side. So in order to represent the benefit that we needed to build, we needed a solid foundation. And that came with sort of accessing WPATH and CPATH, who also afforded us some additional contacts with the GRS in Montreal and Rainbow Health in Toronto. And I was also able to talk to a really amazing plastic surgeon who is on the WPATH board in Chicago. So we ended up with a really solid foundation of the facts, but facts only take you so far. So one of the biggest pieces of advice, or best pieces of advice, I should say, that came out of that fact finding was with one of our contacts from Rainbow Health, who had said, what's been missing in the gender affirmation landscape is conversations with the actual community. Please go out and talk to those affected and those within the transgender community. So we took that advice to heart. We thought it was incredible. And we ended up approaching one of our largest plan sponsors, who we had talked to before through, their diversity team. And we asked them if they would be willing to participate in focus groups. And the focus groups would be those touched by transgender journeys. So employees that are transgender, parents of transgender, gender questioning youth, and their administration. So they not only agreed to it, but they set it up, and we were able to have some very open and honest question and answer sessions, both about benefit type of things and gaps that they're experiencing, but also what they experience on a day-to-day basis. How are they approached, or how are they engaged when they're talking to other customer service call centers? What were their biggest issues with, gendered language? What could we do better on that aspect of it? And they were also able to talk about, legal hurdles, just the things that they actually have to encounter day after day. And it was very eye-opening. So not just from creating a benefit standpoint, but what was a day in the life that they had to go through, and what could we do as a company to make that better? If you had to contact Green Shield, how could we make that experience better for you? Not just because we're building a benefit, but if you were calling in, how could we make it better? So they were very helpful that way. So those conversations actually drove what we're covering.
Yeah.
So apart from everything else, those conversations were very, very important to us. Then, of course, we have the system enhancements. I'm not going to bore you with all of the technical aspects, but there are many, many areas of Green Shields that were helpful in making sure this is up and running. And then the training to degender language, which very much brought awareness to diversity, equity, and inclusion for ourselves. And, we just discovered removing honor ethics, and using parent instead of mom and dad were all simple things we could do in our everyday language to make those who are calling Green Shield a little bit more comfortable. Yeah.
Awesome. And can you now explain the coverage to us and why it was necessary to include what you did?
For sure. So the coverage is actually set out in two categories. Both are standardly included. As always, plan members will be pointed to provincial coverage first because that is necessary. But the two categories are foundation and focused. Foundation includes reimbursement for core surgeries not covered by provincial plans, and services that assist in the physical alignment of the individual's transition gender. So these are things like vocal surgery, tracheal shave, chest contouring and breast construction, vaginal dilators, facial feminization, and laser hair removal. Now, the focused benefit includes reimbursement for surgical enhancement of the individual's features that follow their accepted gender ideal. So these procedures include nose surgery, liposuction and lipofilling, face and eyelid lifts, lip and cheek fillers, hair transplantation and implants, and gluteal lift and implants. So the reason why we had these two is that the foundation was great, but sometimes you need something that is a little bit more focused. So if a person is going through facial feminization surgery, a lot of the time they don't have the structure left and their skin tends to sag a little bit. So they don't have that volume left to be able to support the overlying structures. So this is why a facelift or even a brow lift or, a chin lift, something is a little bit more appropriate for one person than another. Like we said, each person's journey to feeling whole is different and must be respected. And it's looking at the person as a whole. So as long as we can assist in making that journey a little bit easier, then that's what we were going to do.
Fantastic. And another one from Melissa. So what do you feel happens if an organization considers that the standard or the focused benefit is too much of a risk for their plan?
Well, they're able to opt out of the coverage. It's absolutely possible they can do that. I think the implication, though, is something that needs to be discussed, right? The implication is more around a transgender individual not feeling validated or valued within their company's framework. So I think that has a lot of downstream effects if it's not included. A big part of corporate Canada is looking at diversity, equity, and inclusion as platforms, which they should, especially now, especially in the environment that we're living in today. But this benefit is so important to support, like we were talking about before, the family as a whole. The costs associated with gender transition, and we have to remember that this is a small population of the Canadian, right? It's a small population of folks, but the costs associated with it can be very large. So even this help from a plan sponsor goes a very, very long way in helping a family move forward and budget for what their loved one needs. So yes, they can opt out. It is possible, but it does send a message that maybe the value is not there, and that's not something we want to promote.
Yeah. And it's worth mentioning that there are maximums to the coverage that you're offering.
You're absolutely right. So the maximums in the RNC, the reasonable and customary, are based on an average. We know that the maximums are not going to be covering a person's full journey. Even the RNCs, they're $5,000 each for the focused and the foundation. We know that it is not going to cover 100% of each one of those services that we've listed, but it's going to be close. So even if it's a help for a person, it really gets them to the point where they can do a few things that might be covered in full, or they can do one bigger thing and have a little bit more coverage that way. So there are maximums in place as well. If the plan sponsor wanted to increase them, they have that option. We can make that happen as well.
Yeah. And I mean, I think it's just worth noting that, gender dysphoria is diagnosed, just as diabetes is diagnosed, and we help diabetes without even thinking about it. It's part of standard coverage, and so I think it's wonderful that you added this as a standard benefit, because it's simply a diagnosed condition that needs to be taken care of in its own individual way. So, Jen, I think we'll probably pass this over to you. Are there any concerns? Melissa did kind of, mention that it would be seen to be, kind of uncaring and diminishing the value of a person that is transitioning. But are there any concerns from a human rights standpoint if an employer does decide to remove a benefit?
It's potentially, if it was initially offered in the plan and then taken out, potentially there could be some legal ramifications there. Otherwise, I don't think we're quite there yet. It's again more of the culture and creating a safe and inclusive environment for that person, and being that proactive employer, and taking that next step. And it's there's the legal side, but then it's also like what can you do for your employees who are helping run your business, and what can you do to give back just a little bit and make their career just that much nicer and kinder and safer, and help them with their own personal goals.
Yeah. And not just career. It's their life, to be valued at your workplace, is so important, and for your peers, your colleagues to also see and understand that value is so important. So Melissa, I mean, this was a huge undertaking, and I, as a mum of a transgender teen, I can't thank you enough for this work. I mean, it's so meaningful, and I'm really interested to watch how this unfolds, and to see what a difference it's going to make in the lives of anyone transitioning. Is there anything else in the pipeline that you're working on now? Are you taking a break for a little bit?
Well, this was a couple year journey. I have to say, It is, I have truly found out that one person can make a difference. I know that that's highly cliche to say, but you kind of don't realize it until you're doing it, that this can really affect the lives of a great deal, many people. And if we can turn that 40% suicide attempt rate down just, as much as we can, I think that is that's a really good goal to shoot for. So I think there's lots of other things in the pipeline that we're working on, but hopefully we can get through this large project, and where there's going to be a lot of learnings, I think, out of this when it's actually rolled out. By no means do we think this is it. If there are adjustments to be made, we make them. It's an ongoing learning, just to make sure that, like you said, we're listening, we're learning. We need to adapt. It needs to be agile. So if we need to, we'll do it.
Fantastic. Well, it's 2 days away till the launch, and it's a big moment for the group benefits. I really believe that. So thank you so much, both of you, for coming today and discussing. I think it's important information to get out there. If anybody listening is interested in more information, or needs more information on the benefit, or human resources to go along with that benefit, then please reach out to myself, Jane Novak, at selectpath.ca, and I would be more than happy to pass you along to the person that can give you information. And just thank you so much again. I appreciate it.
Thanks,
Jeanette.
Have a great day.
Melissa, great work with all of the research that you've done. So I just think that's awesome. So thanks for including me.
Thanks, Jennifer. It's good to talk to you.
Thanks, ladies.
Thank you.